You know, there's no doubt when I got Dr. Peachy's report, you read the recommendations and you think about those political consequences. But what was clear to me in the very first few months as minister was that there were consequences to doing nothing. And what I continued to hear from staff in the system, frontline staff, is that our system doesn't work. And they express that as in frustration, of course, for the patients that they're caring for. But they also expressed it as frustration as professionals, that they weren't able to do the kind of work that they felt that they could do, that they trained to do, that they wanted to do for Manitoba patients. And so, when I saw Dr. Peachy's report when we met the first time, I kind of thought, boy, this is going to be difficult. But then I thought about the consequences of doing nothing. And I thought that would be more difficult. So sometimes you have to be bold to make changes. Sometimes you have to be bold to improve the outcomes for Manitobans. And we're confident that by following the evidence that's been provided by Dr. Peachy and others, that it is going to improve patient care for Manitobans, and we're willing to make the difficult decisions for that outcome.
And I think at that time it became very evident that despite compelling evidence, there was still the mindset in providers and certainly in patients that if only there was more. The more is better phenomenon was dominant. And so that's a psychic shift to say, you know what, there's sort of a redistribution rather than more is much more logical.
No, and I think that one of the things that we learned early on is that when you looked at the system, if more was better, we'd have an excellent system, because we've been putting more into the Manitoba healthcare system than most other provinces had on a per capita basis. So doing the same thing over and over again wasn't going to get us better results. So the evidence led us, and your recommendations, Doctor, provided us a bold direction, but direction that we believe today very firmly will be better for patients. Yes, that's the ultimate outcome. But for those who are working with patients, we should never lose sight of the fact that those who are working in the system want to do their best each and every day for those who they were serving. And it's going to benefit those who are working in the system as well.
And one of the very first lines in the report is a truism, is that if you're not doing it for the patient, why are you doing it? It has to be patient-centered.